Colon polyps are abnormal growths of tissue that are found inside your colon. And I like to compare them to moles on your skin because some moles are benign, not an issue, and some of them can be a cancerous or a precancerous type of spot. And some people grow lots and lots of polyps or moles, and some people don't have any their entire lives. The most common types that we see are hyperplastic polyps. Those are the type that are just an overgrowth of normal colon tissue. Adenomas, such as tubular adenomas or sessile serrated adenomas, are also quite common, and these are the type that have a cancerous potential. So if they are left to grow in your colon or in your bowels over years and years, they can grow into a cancer. Possibly, if you have a large polyp, you can have things like anemia or blood in your stools. Unlikely, but you could have symptoms of a bowel blockage, such as constipation, abdominal swelling, or abdominal pain. But oftentimes, polyps are small and asymptomatic, and that's why we recommend starting your colonoscopies just as part of your preventative healthcare, even if you feel well and if you don't have any problems with your bowels or your abdomen. Most polyps are able to be removed during your colonoscopy, and depending on the number of polyps, the size of polyps, and then those different types of polyps that we find, that's how we advise you on when your next colonoscopy should be performed. Staying on track with your advised colonoscopies is the most important thing, because we do know that once you start growing polyps, you're at risk for growing more of them. And one thing to keep in mind is that certain types of polyps can grow a little faster. So your doctor might recommend, or I might recommend, you coming in sooner than a friend or a family member based on the type of polyp that you grow. We do know that there are some risk factors for growing polyps. Well, some risk factors, unfortunately, we can't control. Things like your genetic or inherited risk. For example, if you have a polyp growing syndrome that runs in your family, or age and getting older is unfortunately a risk factor for growing polyps. But there are some things that you can change in your lifestyle that will make you less likely to grow polyps in the future. So stopping tobacco, eating a healthy diet that's high in fibrous foods, eating less red meat and processed meat, and staying at a healthy weight and preventing obesity can also decrease your chances of growing polyps. But there are some patients who don't have any of those inherited or lifestyle risk factors that unfortunately still grow colon polyps. And that's okay. We just know that we need to check your colon a little bit more frequently.